welcome everyone to our NCCOR Connect and Explore webinar and just quickly go over what we'll cover today. We will spotlight two of the Measures Registry user guides, the Individual Physical Activity Guide and the Physical Activity Environment Guide. And then following that, we'll save some time so that the speakers can answer any questions you might have on this called one-on-one session. And then finally, we'll share some upcoming NCCOR events and tell you about a new white paper. If you have a question for our speakers during the presentation, please write it in the chat box on the right side of your screen. If you need technical assistance, please let us know using the same chat box. And if you're having trouble logging into the webinar but can hear us on the phone, please email us at NCCOR, NCCOR, at FHI360.org, and we'll work with you to resolve the problem and get you on the webinar. And finally, one important technical note. If you have decided to listen to our webinar today using your computer speakers, please turn down or mute your computer microphone. This will greatly reduce the potential for background noise. Thank you all. Now, we'll also be live tweeting during the webinar. If you're on Twitter or other social media, we encourage you to join the conversation using the hashtag @ConnectExplore. Be sure to follow the Twitter handle at NCCOR. Now, today's speakers are David Berrigan, Gregory Welk, James Morrow Jr., Pedro Saint-Maurice, Jordan Carlson, and Jim Sallis. David Berrigan is a program director, David, in the Health Behaviors Research Branch of the National Cancer Institute, which is a part of the National Institutes of Health. He was a co-lead on the NCCOR Measures Registry Workgroup, along with Jill Reedy. Gregory Welk is an associate professor in the Department of Kinesiology at Iowa State University and an author of the Individual Physical Activity Guide. James Morrow Jr. is the Regents Professor Emeritus in the Department of Kinesiology, Health Promotion, and Recreation at the University of North Texas. And he's also an author of the Individual Physical Activity Guide. Moving right along, we have Pedro Saint-Maurice, who's a postdoctoral fellow at the National Cancer Institute, part of NIH, and he's also an author of the Individual Physical Activity Guide. Jordan Carlson is Director of Community Engaged Research at Children's Mercy in Kansas City, Missouri. He's an author of the Physical Activity Environment Guide. And Jim Sallis is a Distinguished Professor Emeritus at the Department of Family Medicine and Public Health at the University of California, San Diego, and also an author of the Physical Activity Environmental Guide. We're very grateful to this great roster of speakers for taking the time to join us today. And just before we hear from them, we'd like to start with a brief poll so they know a little bit about you. You can submit your answer to this one simple question right on the screen. Did you attend part 1 of our webinar on individual diet and food environment? Okay, if everybody's had a chance. Okay, we can see that speakers, you should know that a lot of the participants are here for the first time, so we're delighted to have you join us. And at this point, I'd like to turn it over to David Berrigan to introduce the Measures Registry User Guides project. David?
Elaine, David Berrigan from NCI here, and the next 5 slides will be familiar to the 15 or so people that saw the previous webinar, but so stay calm. This will be over shortly. So I'm extremely happy to be introducing this webinar concerning the NCCOR Measures Registry User Guides, and I want to give a big acknowledgement to Jill Reedy here at NCI, my co-lead on this project, and Amanda Samuels from NCCOR, who was a tremendous help in organizing these projects. And last, we want to acknowledge the JPB Foundation, which provided funding for the development of these guides. The NCCOR Measures Registry, as you know, is a free online repository of articles about measures and is widely recognized as a key resource that gives researchers and practitioners access to detailed information on measures in one easy-to-search location. Even with this resource, however, it can be challenging for users to choose the most appropriate measures for their work. So we conceived of this set of user guides that were designed to provide an overview of measurement, describe general principles of measures selection, and present case studies to walk users through the process of using the measures registry to select appropriate measures for their studies of childhood obesity and its determinants, notably diet, physical activity, and their environmental influences. Our hope is that the user guides will help move the field forward by fostering more consistent use of measures, which will allow for standardization, meta-analyses, synthesis, and more valid and reliable measures in all our studies. The user guides cover the 4 domains of the measures registry: individual diet, the food environment, individual physical activity, and the physical activity environment. Today we're going to hear from 2 groups of authors who will talk about the guides to the physical activity environment and the individual level physical activity measures. As I said, we really hope this will help people select the best available measures and help move us towards more comparability in different studies. That's a long-term dream. The next few slides, I'm just showing you the web pages. You may be clicking through these web pages while you listen to the speakers. There's a home page with the measures registry, then a subsequent page launching the 4 user guides, and then you can click onto the individual guides themselves, which are detailed monograph-length introductions to measurement in these 4 domains. So the authors and expert panels that advised us on these guides are shown in this current slide. And I want to note that a couple of weeks ago, Jill Reedy hosted a webinar about the individual diet measure guide and the food environment guide. And that webinar is available to view at your leisure from the NCCOR website. So without further ado, I'm delighted to turn it over to Greg Welk and his team, who are going to talk about the measures registry guides to individual physical activity. Thank you.
Yep, thank you, David. Yeah, we appreciate the chance to share some highlights of the individual measures guide we worked on. In 15 minutes, we can't really cover a lot of detail, so we'd encourage you to download the actual guide and look at that as part of your exploration of the measures registry if you haven't done that already. So we've divided our presentation into thirds because there's 3 of us that worked on it together. So I'll take the first 5 minutes and provide an overview of some concepts and models we used in the guide. Jim will then cover issues with measurement in different types of research settings and how to look for those in the measures registry. And then Pedro will provide a case study or kind of an example of how you could use that to answer a specific or to make a specific choice about a measure for a particular study. I did want to point out that in the title here of Measures Registry, the word measures is used as a noun, and that's intentional. And in the guide, we specifically point out that we can really only, with the current tools, assess activity behavior or estimate it and not truly measure it. So while you can measure height and weight, we contend that you really can only estimate or assess physical activity behavior. Let me click moving here. So that being said, there's a strong need for accurate estimates of individual physical activity behavior to answer a lot of different research questions. We need accurate estimates to understand physiological mechanisms, to understand amount of activity needed for health, to monitor patterns and trends in activity, to identify correlates of activity and to test theories, and then to hopefully apply those insights to design effective interventions and to evaluate the interventions. So these are just examples, but within the guide, we used a behavioral epidemiology framework to kind of categorize the different types of research into 5 different types. The reason for that is that the measurement issues and the importance of reliability and validity vary depending on the type of research question that's at play. So sometimes physical activity may be used as an independent variable, sometimes as a dependent variable. Sometimes you need a really accurate measure for individuals in the study. Other times you just need an accurate estimate of a group level of individuals. And Jim will go over some of those distinctions in his section. So because this is a complex picture, I wanted to walk you through it in a little bit more detail. So I'm going to start at the lower right and cover some examples of each of the different rectangles here of types of research. So basic research provides the foundation for us to understand physiological mechanisms influencing health. Above that, where it labels epidemiology, we can also call that kind of health outcomes research, and that builds on this knowledge and quantifies the specific associations between behaviors and health outcomes. That information helps in establishing guidelines and recommendations, which is depicted in the curved arrow there. For example, in the past, the research that showed that even moderate amounts of activity can reduce health risks led to paradigm shifts in how activity was promoted, and that also has implications for how we need to assess it. Surveillance research refers to the ways in which we try to understand patterns and trends and also health disparities in the population. Theory and correlates research, moving around the square here, then tries to explain those patterns and trends and tries to test theories that might help us predict physical activity behavior. And again, that being said, we hope to apply that information with intervention research where you see there's a double-headed arrow pointing back to the center. And we intentionally depicted physical activity and sedentary behavior in the center in the model because it signifies the centrality of accurate assessment methods to advance research in each of these areas. So you see there's arrows going out to each of these different categories. We also intentionally used 3 overlapping circles to show that the 3 different types of measures are providing slightly different information and may not be all giving you the same insights. And it also indicates that in optimal situations you would use more than one. So in many cases it's good to use a report-based measure along with more of a activity-based measure, an outcome-based measure. So we distinguish between these also as report-based and monitor-based measures in the guide. And we also want to point out the distinction that we avoided using the terms subjective and objective. You'll see that a lot in the literature. But often the word subjective kind of has some negative connotations and objective has positive connotations, but we kind of equate them both as being equally useful for different types of research questions. So oftentimes a simple survey is all you really need to answer that question. And so we place a lot of emphasis on making choices between report-based measures that could include self-report, proxies, or diaries, and the relative advantages of monitor-based measures that could include accelerometers, pedometers, heart rate monitors, or GPS units, and criterion measures. So each of these has relative advantages and disadvantages, and we depict that in the guide with this feasibility-validity continuum. So you'll see that report-based measures are up here at the top, and they're very feasible, but maybe not as valid. Criterion measures down here are highly valid, but not that feasible. And in between are monitor-based measures that kind of provide a balance between feasibility and validity. So I'm going to turn it over to Jim, and he'll walk you through kind of how to interpret these indicators within the guide, because the guide provides information about reliability and validity of different measures. So take it away, Jim.
Thanks, Greg. Regardless whatever you might measure, you're concerned about the validity and reliability of those estimates, those measures, those characteristics of which you're trying to assess people. And if you take a look at this figure, you can see here's reliability on the vertical axis and validity on the horizontal axis. Essentially what you want to try and do is get the most valid and reliable measure that you can possibly obtain. And the registry guide provides you with that kind of information. Now, there are important caveats that come into play when you select those. Are you selecting them for individuals or for groups and so forth? So, for example, just as a basic introduction, reliability is simply the consistency of measurement. If you have different raters observing some behavior, what's the objectivity of that? Then there's test-retest. We could test people and test them again on another occasion. If there's no behavior change, you should get the same results. And then if you had a written form, you might look at the internal consistency reliability. All of those are represented as reliability, but calculated in different ways and interpreted in slightly different ways. Here again, the registry measure, the registry will actually give you indications of what the reliability and validity indices are for the methods that you might have chosen. With regard to validity, there are a variety of different ways that you might look at validity as well. As important as reliability is, ultimately the most important decision is, did I accurately measure what I thought I was going to measure? Whether it's behavior, whether it's self-report, whether it's observation, did I accurately measure what I said I was going to do? In the guide itself, we expand on these a great deal, so you can turn to the guide to find more information about that. Importantly, whenever you look at the reliability and validity measures, you might be looking at continuous measures. For example, on the left-hand side here, you might be looking at minutes of MVPA, or number of steps per day, or number of days in which a person engaged in musculoskeletal physical activity. And so you would use these methods on the left to look at the reliability and validity. And then on the right, you might have categorical variables. For example, do you meet the physical activity guidelines? Do you engage in 150 minutes or more of MVPA per week? If you're a youth, do you engage in 60 minutes of physical activity daily? Or how many days of muscle strengthening activities? In those cases, you're going to use different procedures and different methods to interpret the reliability and validity because you have categorical variables now. You have to carefully consider the kinds of reliability and validity estimates that you have. Are you looking at individual behaviors or are you looking at group behaviors? Most of the reported values in the guide and in the registry talk about individual reliabilities and individual validities. It's important to realize that you might be working with groups. You'll need to look at the group reliability and the group validity. I'd like to now use 3 different examples and talk about the kinds of measurement issues that might come into play that impact the reliability and validity of the instrument that you might choose to use. So in this example, these are health outcomes research. Often you have categorical variables. Are you diseased? Are you not diseased? Do you engage in sufficient physical activity? And the ultimate, are you alive or dead? So in that case, you'll have categorical variables. You need to think about the right procedures that you would use with regard to categorical variables. In this slide, we look at surveillance research. Now you're going to look at large numbers of people. How can you gather data as efficiently as possible, make it reliable, make it objective, make it valid when you have large numbers of people in which you want to distinguish those characteristics? It's important to realize that even small changes in words will greatly impact a person's impressions about what the statement might be. For example, are the words typical? Are the words daily? Are the words average? Are those the same kinds of words? Are they interpreted by people always in the same way? They often are not. That brings into mind the issue of cultural differentiations that might come into play. For example, leisure time physical activity might have no meaning whatsoever to some cultures. So what kinds of words that you ask might greatly impact what the validity of your results might be. And then in this case, we have physical activity intervention research. Perhaps one of the most important concepts here is you want to try and impact individuals or communities or people's lives. You want to say, here's where we are today. Let's intervene in their lives. And now let's see, have we truly modified that behavior? Well, it's important then that you have a measure that accurately taps any change that might occur. Some of the measures might be much more fine. Others might be much more gross, so that if you're attempting to measure that behavior, really you can't see the change because the measure is not sensitive enough to do that. So if you're doing intervention research, it's key to have measures that will be able to track those changes that occur. Lastly, important in the guide, as I show in this example here, you'll notice we have the guide, and in the upper right-hand corner, it has validity and reliability. Here are two tabs that you can click on for any particular study that you found in the guide. You can click on that and you can find out about the reliability and validity that's reported in that particular abstract or paper that was presented. However, most important, any reliability and validity is specific to that particular study. So you have to be careful. Just because someone did a study with 9th grade girls doesn't mean it's going to necessarily work with 9th grade boys. Or if it's done with junior high school boys, what's to come into play when you select those. Are you selecting them for individuals or for groups and so forth? So, for example, just as a basic introduction, reliability is simply the consistency of measurement. If you have different raters observing some behavior, what's the objectivity of that? Then there's test-retest. We could test people and test them again on another occasion. If there's no behavior change, you should get the same results. And then if you had a written form, you might look at the internal consistency, reliability. All of those are represented as reliability, but calculated in different ways and interpreted in slightly different ways. Here again, the registry will actually give you indications of what the reliability and validity indices are for the methods that you might have chosen. With regard to validity, there are a variety of different ways that you might look at validity as well. As important as reliability is, ultimately the most important decision is, did I accurately measure what I thought I was going to measure? Whether it's behavior, whether it's self-report, whether it's observation, did I accurately measure what I said I was going to do? In the guide itself, we expand on these a great deal, so you can turn to the guide to find more information about that. Importantly, whenever you look at the reliability and validity measures, you might be looking at continuous measures. For example, on the left-hand side here, you might be looking at minutes of MVPA, or number of steps per day, or number of days in which a person engaged in musculoskeletal physical activity. And so you would use these methods on the left to look at the reliability and validity. And then on the right, you might have categorical variables. For example, do you meet the physical activity guidelines? Do you engage in 150 minutes or more of MVPA per week? If you're a youth, do you engage in 60 minutes of physical activity daily? Or how many days of muscle strengthening activities? In those cases, you're going to use different procedures and different methods to interpret the reliability and validity because you have categorical variables now. You have to carefully consider the kinds of reliability and validity estimates that you have. Are you looking at individual behaviors or are you looking at group behaviors? Most of the reported values in the guide and in the registry talk about individual reliabilities and individual validities. It's important to realize that you might be working with groups, and you'll need to look at the group reliability and the group validity. I'd like to now use 3 different examples and talk about the kinds of measurement issues that might come into play that impact the reliability and validity of the instrument that you might choose to use. So in this example, these are health outcomes research. Often you have categorical variables. Are you diseased? Are you not diseased? Do you engage in sufficient physical activity? And the ultimate, are you alive or dead? So in that case, you'll have categorical variables. You need to think about the right procedures that you would use with regard to categorical variables. In this slide, we look at surveillance research. Now you're going to look at large numbers of people. How can you gather data as efficiently as possible, make it reliable, make it objective, make it valid when you have large numbers of people in which you want to distinguish those characteristics? It's important to realize that even small changes in words will greatly impact a person's impressions about what the statement might be. For example, are the words typical? Are the words daily? Are the words average? Are those the same kinds of words? Are they interpreted by people always in the same way? They often are not. That brings into mind the issue of cultural differentiations that might come into play. For example, leisure time physical activity might have no meaning whatsoever to some cultures. So what kinds of words that you ask might greatly impact what the validity of your results might be. And then in this case, we have physical activity intervention research. Perhaps one of the most important concepts here is you want to try and impact individuals or communities or people's lives. You want to say, here's where we are today. Let's intervene in their lives. And now let's see, have we truly modified that behavior? Well, it's important then that you have a measure that accurately taps any change that might occur. Some of the measures might be much more fine. Others might be much more gross, so that if you're attempting to measure that behavior, really you can't see the change because the measure is not sensitive enough to do that. So if you're doing intervention research, it's key to have measures that will be able to track those changes that occur. Lastly, important in the guide, as I show in this example here, you'll notice we have the guide, and in the upper right-hand corner, it has validity and reliability. Here are two tabs that you can click on for any particular study that you found in the guide. You can click on that and you can find out about the reliability and validity that's reported in that particular abstract or paper that was presented. However, most important, any reliability and validity is specific to that particular study. So you have to be careful. Just because someone did a study with 9th grade girls doesn't mean it's going to necessarily work with 9th grade boys. Or if it's done with junior high school boys, it may not work with college-age students. So don't necessarily rely only on the reliability and validity that has been reported to you in the abstract or in the paper. It's sensitive. It's specific to that particular study. So if you're going to use a particular instrument, make sure that it's culturally appropriate, the language is such, or the instrumentation is designed in such a way that a person will be able to interpret it, and so that the measures you have taken are reliable and they truly reflect the behavior or the reported activity in which a person engages. So reliability and validity, started out saying it was important. It's important in any of the studies. Make sure you know what the reliability and validity characteristics are of your particular study. With that in mind, I'll turn it over to Pedro now, and he'll give an illustration of a case study for individual physical activity assessment. Pedro?
Thank you, Jim. Okay, so let me now describe you the 4 case studies that we developed and are integrated within the guide as a way to apply the content that comes up on the previous sections that Greg and Jim just described. So for that purpose, we developed 4 case studies that you can find in the guide, and each one of those actually describe each one of the study designs that are within the behavioral epidemiology framework. Now, for the purpose of the presentation, I'll focus on case study 2, just for simplicity. So in this case study, we're looking at the typical surveillance research study or project, where a large research team is interested in capturing activity levels across the country in school-age children or adolescents. So the first step is to define what a physical activity outcome is. And for this purpose, the research team is interested in looking at the proportion of youth that would accumulate 60 minutes of moderate to vigorous physical activity per day. Another interest of them would be to capture how many would accumulate 30 minutes a day of MVPA as well. So with this in mind, we start thinking about different considerations that we have to take into account. And of course, the first one is the measure we're looking at. Is it appropriate for across all age ranges, from 8 to 18? And for that purpose, any of the measures in the measures registry actually would apply. Okay. Now the second consideration would be, does the measure capture the context that we are interested in? And in this case, as the interest is in out of school and school activity, then we probably scroll down and end up looking at self-reports and diaries. Now keep in mind that you can also use monitor-based measure, although you will likely need additional information to do that. Okay, and the last point would be looking at feasibility. And this goes back to the feasibility validity continuum that is explained in section 5 of the guide, and that Greg just described before. And to this point, you start thinking, okay, so I'm working with a large sample across the country, so I probably want to favor feasibility, right, just to make sure I can collect data across all these children and adolescents in a feasible manner. The second point is, it probably needs to have some educational value. I mean, we're working with schools, so we want to make sure that children and adolescents will benefit from the assessment. So with that in mind, we probably screen down to self-reports and diaries. Now keep in mind that diaries might be pretty challenging to use, especially for young children, because it would require for a child to detail all activity they did throughout the day. So with that consideration, we probably suggest to use a self-report measure. And probably would be very wise to use a web-based version. Nowadays, there are already a few self-reports that are available on a web-based format. And that will just facilitate standardization and just facilitate the collection of data. Okay? So you can actually come down to the summary table that just describes all the considerations that I've just described to you and the rationale for a measure that you're likely to select. And this is even a good exercise for your own or for your team to write down the information and think really careful what type of study or project you're thinking about conducting, and then make a decision about your measure. All right? With now, always keep in mind that once you do that, now you get to a step that you need to actually select a measure you want to use. And that's why the measures registry is really useful. Going back, it does allow you to filter the data, look at individual physical activity measures that exist out there, and just look through the different studies and the exact measures and look at index of validity and reliability, just like Jim described, and decide what measure you want to use. Okay, so this section, or the guide, individual physical activity guide, we described to you different types of studies and how each one is unique and are likely to impact the measure you're going to select. We described to you the distinction between reliability and validity, which is really important. And we look at how there are different measures. And keep in mind that no measure is perfect. So with that in mind, you can have to balance out between feasibility and validity and decide which one is going to help most for the type of study or project you're willing to do. Now, once you do that, you can actually look through the case studies and see how can you apply that content and even as an exercise for your team or for yourself. Thank you, and I'll pass it back to Elaine.
Thank you so much, Jim and Pedro. That was a wonderful overview, and it makes me really want to go read the guide right after this call. So as a reminder to our listeners today, if you would like to ask a question, please use the chat box on the right of your screen. I see some people have been using it already, but if you have a question for a speaker, we will have time to share those questions for speakers to respond. So please feel free to add there. And now I will turn it over to Jim and Jordan to discuss the Physical Activity Environment Guide. Jim? Jim, are you on mute?
I am on mute. Okay. Thank you. So thanks to Elaine for organizing this and for all the support for these user guides. And I just want to note that I'll start, and then Jordan Carlson will provide an overview of some case studies. So measuring the physical activity environment. Not everybody studies physical activity environments, but we think this is an important way to understand the context for activity and some of the underlying reasons for why many people are not at all ages, many people at all ages are not meeting guidelines. So multiple settings are important for physical activity, including neighborhoods, parks and recreation facilities, schools, and homes. And we have now evidence on all of these. The built environments within each setting can support or inhibit physical activity. So that means that the built environments reflect decisions that are made by different sectors of society. And then measuring physical activity environments can inform intervention strategies and support evaluation for both research and practice. So we've certainly oriented this guide to be useful for both researchers and practitioners. Now, there are many measures in the measures registry about physical activity environments. There's a lot of diversity there, and I want to give you just a little overview of that. So on the left-hand side column are the different settings that reflect how the guide is organized. I won't read all of them, but you can see there's a great diversity. Across the top are the three methods of assessment of these settings that are also covered in the guide. And you can see that GIS is the most limited. It really is mainly useful for community design and the transportation system. And usually we're at the mercy of whatever GIS data are available either through government agencies or commercially. Now, there are, you can in GIS get the locations of trails, parks, schools, and other places, but this is mainly useful for proximity. If you want more detail about the characteristics of the environments and the settings, you need other measures. So you can see that there are observational measures for almost all of the settings, and questionnaire measures for all of the settings. So you have some decisions to make, and that's a good thing that there are options. We also like to think about levels of environmental attributes, the macro scale, describing the layout of the community or the design of the community. And that includes connectivity of streets and different land uses. At the micro scale, that indicates the design of a setting, the more detailed aspects. In a streetscape, we might look at whether sidewalks are there and the quality. We can look at street crossings. We can look at not just is a park close by, but what's in that park? What are the options for physical activity? And in a building, we can look at, let's say, accessibility of stairs. It's also important to consider the social environments. These are evidence of people's behavior. And so indicators of safety, which could be built environment things like graffiti or abandoned buildings, which are also indicators of social disorder. They could be presence of homeless people and that sort of thing. So crime could be is often considered a social environment factor. So there's again a variety of ways of looking at these, and we think of three dimensions of these attributes. At the most basic level is the proximity, and this is the presence, absence, or distance to an environmental feature. Do you have any parks within walking distance of your house? What about stores and shops? So this is an indicator of mixed use. But the presence doesn't tell you anything about the quality, and it doesn't tell you necessarily the accessibility. And so this is the ease of getting to a feature. So a park may be nearby, but there may be barriers between you, like a freeway, or you may have a subway station within a kilometer, but it's unsafe to walk or bicycle there because the connections are not well designed. So that has to do with accessibility. And then we have quality. And so these relate to a feature's design, aesthetics, appeal, condition, ease of use, or safety. And this can apply to sidewalks. It can apply to buildings. It can apply to parks. So the quality is an important consideration as well and can be assessed. So now I'm going to turn it over to Jordan Carlson, and he will talk about a case study or two.
Great. Thanks, Jim. So now we're going to present two case studies to show examples of how the Measures Registry can be used to select physical activity environment measures for research or practice. So these case studies appear in more detail in the user's guide. And so here's some key factors that you want to consider when selecting physical activity environment measures. One, what is the purpose of the project? Is it to inform an intervention or an environmental improvement? Is it to evaluate an environmental change? Or is it to investigate associations between specific environmental features and physical activity, for example? So for number two, is the measure reliable and valid? Some measures in the registry have been tested for reliability and validity, whereas others have not. And so this information can be found in the reliability and validity tabs once you navigate to the main page for a given measure. And so Jim Morrow showed a slide describing this earlier in this presentation. And so number three, how important are investigator and participant burden? Will response rates be low if the survey is too long? Or will important information be missed if the survey or measure is too brief? And then finally, number four is, do you want a comprehensive measure that covers multiple constructs? Or do you really want to narrow in on one specific construct in detail? And so case study one is about planning a project to improve parks and streetscapes around schools. And so in this case study, a local bicycle and pedestrian advocacy organization is working with a city planning department to improve environments around schools to support active living. And so the funding mechanism for this grant will support infrastructure improvements. And so the Bike Ped organization wants to identify specific locations and specific types of improvements to target to seek funding for. So the organization has four primary factors that they have identified as important considerations for measure selection. The organization wants to target settings that are known to be related to physical activity in youth. So they review published studies, and then they select streetscapes and parks as the settings of interest that they want to target. Next, the organization wants to focus on environmental features that would be feasible to modify during the 2-year grant period. So they focus on micro-scale rather than macro-scale features. And so Jim Sallis talked a little bit about those earlier. And so this eliminates GIS-based measures because those measures typically cover macro-level community design features, which are often less amenable to change, as Jim Sallis mentioned. And the organization also wants to involve community members in the project, so the measure that they select needs to be brief and require little training so that it can be feasible to use with the community members. And finally, the organization has ruled out GIS measures, as I mentioned, so now they need to select between either audit measures or questionnaires. They review both, and they find that the audit tools appear to be more specific in regards to identifying actual areas and environmental attributes to target for improvement. So they think that they want to go with an audit-based measure. So here's the measure selection process the organization goes through. And so earlier Pedro showed kind of a screenshot of the different check boxes in the NCCOR measures registry. And so what this organization is doing is using those check boxes. They're setting appropriate filters to narrow their search in the registry. They're using search terms to focus on the desired settings of streetscapes and parks. And then they end at about 10 to 15 results, and then they use the compare function to compare across these different 10 to 15 measures that they arrive upon. They review these measures in more detail. So for the streetscape audit tool, the organization selects the active neighborhood checklist. They like it because it's brief. It includes a code book and training materials, and it's been previously used by practitioners, which is a bonus for them, and it also has evidence of reliability and validity. And so that's an example of how they come to choose that measure. For the parks measure, they choose the CPAT park audit tool. So they see that there are several park audit tools. They really like the CPAT because of its previous use by practitioners again, and then also its evidence of reliability and validity. However, CPAT is a long tool. It includes 140 items, and so the organization thinks that that's too many, so they want to focus on a narrow set of items. So what they do is they select a subset of items based on community input, and then they also consider published evidence of the items. So what has the best reliability and validity, and what has the most evidence for relationships with health. So here's a summary of that case study. And so I'm going to skip case study 2 from the user's guide. So here's case study 3, and it's about conducting an evaluation of streetscape renovation projects. So in this study, a city is conducting an infrastructure improvement projects, and then a research team wants to evaluate whether the city's infrastructure projects resulted in significant improvements to the physical activity environment. The team has 3 major considerations in selecting a measure. First, the infrastructure projects specifically target streetscapes, so the setting is already determined. They want to focus on streetscapes. Second, the constructs covered need to have shown consistent relationships with physical activity in previous studies so that health implications can be gauged. They want to make sure that they're focusing on constructs that are going to be most related to physical activity. And then third, the tool needs to be sensitive to change because they're going to use a pre-post design, and they really want to be able to capture the changes being targeted by the renovation projects. So given those considerations, the research team thinks that audit tools appear more promising than a questionnaire for this certain particular circumstance because of their level of specificity to capture environmental features. What they do is they select a subset of items based on community input, and then they also consider published evidence of the items. So what has the best reliability and validity, and what has the most evidence for relationships with health. So here's a summary of that case study. And so I'm going to skip case study 2 from the user's guide. So here's case study 3, and it's about conducting an evaluation of streetscape renovation projects. So in this study, a city is conducting an infrastructure improvement projects, and then a research team wants to evaluate whether the city's infrastructure projects resulted in significant improvements to the physical activity environment. The team has 3 major considerations in selecting a measure. First, the infrastructure projects specifically target streetscapes, so the setting is already determined. They want to focus on streetscapes. Second, the constructs covered need to have shown consistent relationships with physical activity in previous studies so that health implications can be gauged. They want to make sure that they're focusing on constructs that are going to be most related to physical activity. And then third, the tool needs to be sensitive to change because they're going to use a pre-post design, and they really want to be able to capture the changes being targeted by the renovation projects. So given those considerations, the research team thinks that audit tools appear more promising than a questionnaire for this certain particular circumstance because of their level of specificity to capture environmental features. And so again, here's this team's, how they use the measures registry in their selection process. So the appropriate filters and search terms are used to narrow the search. Measures are compared. Some are immediately ruled out either due to their lack of specificity or their lack of detail or reliability and validity. And so the team ends up narrowing on 3 comprehensive streetscape audit tools. The tools appear to have similar content and similar supporting evidence. So any of these 3 tools would likely be a good fit. They review each tool more critically, and then they end up selecting the Irvine, Minnesota inventory because of its specificity. It has evidence of reliability and validity, and has been used in multiple previous studies. So here's a summary of this case study. And so in conclusion, many physical activity environment measures have been developed covering most common physical activity settings. However, the large number of existing measures can make it difficult to select the best measure for the purpose you desire. Thus, NCCOR has created a registry of these measures, and the user's guides that accompany this presentation can facilitate the use of the measures registry. And so most of all, we hope that the measures registry and user's guides will lead to improved research and practice that will accelerate movement towards activity and friendly environments.
Thank you so much, Jim and Jordan. That was another terrific overview. I can think of about a dozen people I want to send this to after the call, and I hope our participants have some thoughts about who they want to share this information with as well. Now, a reminder to participants, if you have a question, please type it in the chat box to the right. And we do have some questions lined up. The first one is a question, Jim Sallis, when you were looking at the social attributes of a park, might there also be a question in a registry that would identify how community members or whether and how they value their parks, in addition to safety and other factors? Is that citizen value measurable?
I'm glad you brought that up. That is an important distinction. Virtually all of the measures in the registry deal with assessing the attribute itself, either the proximity, accessibility, or the quality. So we would, a typical, let's say, question would be, is there a park close to you, or within a 10-minute walk or something? And there's another type of environmental assessment that's more evaluative. What do you think about this park? Is this a safe place to send a child? Is it a good place to do different types of physical activity? And those evaluative questions, I think, are very important, but they tend not to be very standardized. So I think there would be very few of those measures of evaluative perceptions that would show up in the guide. There may be a few among the many measures, but there won't be many. So if you're interested in that aspect, you may need to go to the environmental psychology literature, and you can find reviews of these types of measures. But they certainly are relevant, and I think complement the types of measures that really assess the attribute themselves.
Thank you, Jim. And if there are any participants today who have used those kinds of measures and you are thinking about publication, it would be a great addition to what we can find in the literature. So over to the other Jim Morrow. So in listening to your presentation, there was a question about whether I would need to determine the reliability and validity for my study, or can I rely on what has already been reported in the literature?
Oh, good question. I guess the best advice I would give you is that your sample probably doesn't exactly mirror that was used to report the reliability and validity from that particular instrument or measurement procedure. And so the best advice you might have would be, I need to do a pilot study. And in that pilot study, I'm going to find out whether my processes work. I'm going to find out whether my procedures work. And I'm going to get estimates of the reliability and validity for my particular sample or my group of participants. And in addition to that, once I've actually done the study, I would think that the funding agency or reviewers are going to not only want to know what the reliability and validity was reported for your instrument, what did you find with your people? What was the reliability and validity? So to use a subsample, if nothing else, of your participants to get an estimate of reliability and validity, I think that would be good advice. So don't rely on what's just reported. Report what you have in your participants as well.
That is good advice. Thank you, Jim. And back over to Jim Sallis. There are a lot of different environmental attributes. Which of those might be most important to assess, and which have the best evidence behind them? I understand it might not be the same answer to each of those questions.
Well, that's right. And one of my mentors taught me that the answer to almost every question is the same, and it depends. So one of the things that we've been learning about environments and physical activity is that different environmental attributes are relevant for different kinds and subsets of physical activity or different domains. So, for example, let's say parks are more relevant for doing leisure time physical activity, whereas a measure of mixed use or having shops and services near your home, those provide destinations for walking and bicycling for transportation. And so so one of the things it depends on is the type of activity that you're particularly interested in. And of course, there's some variation by age group. And although I think a lot of the evidence is showing that there's a fair amount of similarity across age groups in the environments that are important for activity or for specific types of activity. So I think it's really not possible to give a clear answer to that specific question, but it really depends on the purpose of your study, the type of population, and the type of physical activity. I guess on the more helpful side, there are many reviews of the environment and physical activity literature, and so there's a fair amount of guidance about for specific populations and situations what are the most promising types of environments to pay special attention to.
Well, thank you both, Jims, because, gee, that's why we have a guide. It's clear that this is guidance, not answers. And so, David Berrigan, over to you for a last question, and that is if someone is moving on from reviewing a case study to actually try to put this in practice for a project that they are developing, and really need to check in on, these sorts of variables that we've been talking about and making a decision, is there any way to get additional help?
Thanks, Elaine. David Berrigan here. NCCOR does not have a formal consultation process, but we're delighted to try to connect people to an appropriate researcher in the area or share expertise from NCCOR members. So if you do have further follow-up questions for specific studies, don't hesitate to send an email to ncor.fhi360.org, and we'll do our best to try to help you. We want to support your research and evaluation efforts in every way that we can.
Thank you so much, David. And again, to all of our panelists, we know how much time you've invested over the last few years and seeing this project plan develop and come to fruition. So it's very exciting to have you here. And next we have just a couple of announcements. The first is that NCCOR will be at the American College of Sports Medicine annual conference this year with a tutorial session called Hot Off the Presses, a revised youth compendium of physical activities. So if you're going to be at that meeting, June 1 o'clock, please join us. And this compendium will be coming soon to the NCCOR website as well. NCCOR staff will be in the exhibition hall in booth 125. And again, if you're at the meeting, please stop, say hi. And any suggestions you might have for us, we'd love to hear from you. And then a new addition to our website is a Health Behavioral Design and Built Environment white paper. We've had a work group working on this, on workshops and developing the paper for the last year or so. And we invite you to read it and share it with others who are considering the role of behavioral design in their work or should be considering it. So with that, thank you so much to this project team that has worked on the guides. And if you have any other questions about NCCOR or our upcoming activities, please email the NCCOR Coordinating Center at NCCOR at FHI360.org. Now, this webinar and every Connect and Explore webinar, including the companion webinar on a diet and food environment, will be archived on our website. To access the webinar, use the top navigation on the website and click on Webinars. So you can see all of the upcoming and the archived webinars displayed there. So again, if there's someone that you want to make sure here's these great presentations, please, that'll be a place to share it with them, and you will be getting an email once this webinar is posted. And thanks again to all of our guest speakers, David, Greg, Jim, Pedro, Jordan, and Jim, for taking the time to be with us today. Now, participants, thank you so much for joining us. We are so happy that you took the time out of your busy schedule to be with us. And before you sign off, one more thing. Please take a moment to complete our very brief survey. Your responses will help us shape future webinars and make the best use of your time. So we're going to switch over to that feedback form right now. You can write your input directly on the screen and hit submit. And have a great afternoon, everyone.